Okay, thank you both. Next, we're going to welcome Ryan Anderson, Community IPM Manager at the IPM Institute of North America, which is the leader in the U.S. on educating farmers, school, healthcare facilities, and on prioritized IPM. They're also the provider of Green Shield certification for facilities managed with dedication to effective, prioritized pest management practices with the least risk to people and the environment. It recognizes advanced practitioners of IPM methods in various arenas, including healthcare. Welcome, Mr. Anderson.
Well, hello, everyone. My name is Ryan Anderson, and I'm the Sustainable Communities Manager for the Integrated Pest Management Institute of North America. We're an environmental nonprofit based out of Madison, Wisconsin, and our mission is to advance sustainability in agriculture and communities through market mechanisms based in integrated pest management. Next. The speakers before me discussed best pest management practices and sanitation. So my presentation will focus on the resources available to you to implement these practices and strategies, specifically as it relates to our Green Shield certified program, whose mission is to increase demand for sustainable pest and weed control services by certifying pest management providers, facilities, and landscapes that pose limited health risks to humans and the environment. In the map that you can see in the image to the right, we have our GSC providers as well as facilities. A lot of them are located in New York, but we certify across the country and even worldwide. We have a couple facilities that we certify, and healthcare facilities fall in that range. And the facilities that we do work with need to pass a rigorous on-site evaluation once every 3 years to ensure you are controlling pest populations by properly eliminating points of entry, food, water, and shelter. Next. These are critical practices for healthcare facilities because pests can cause many health problems. First, there are flies that can carry staph, E. coli, and salmonella. Next, cockroaches, which can trigger asthma, but also carry pneumonia, diarrhea, and food poisoning. We also have mice that are a concern that can spread hantavirus, typhus, and SARS, and also chew on wires, which there are a lot of wires out in healthcare facilities. And finally, birds can carry a number of viruses and diseases too. Next. So our GSC evaluators are essentially putting a magnifying glass to the building maintenance practices that you are already implementing. We look for any cracks or crevices in your building's foundation, such as the doorway to the top right, where pests can enter, or where you can experience energy efficiency losses. We point out any unsanitary drainage situations that can spread disease and feed pests, or we recommend clutter control to keep your hospital clean and remove shelter for pests. Next. Each GSC applicant will receive a comprehensive and detailed evaluation report that includes a list of reduced risk pesticides, products, goals for improving your building maintenance, and strategies to communicate your commitment to healthy buildings. Next. GSC's thoroughness has earned IPM and indoor air quality credit recognition from a number of green building programs, including LEED, WELL, and GRESB. Next. So if you are interested in becoming certified, here is the process. First, you want to schedule that on-site evaluation with a GSC evaluator who is an expert in IPM or pest control. That evaluator will develop an interim report which grades your building maintenance based on our standards. So you need to meet all of our minimum requirements and score 80% or above on our scored practices to achieve GSC recognition. That interim report will come up with recommendations for how to meet your standards, and then we develop a final report after you've addressed those recommendations. And you have a year to address those recommendations to receive GSC recognition. Once you receive that recognition, we start marketing your achievement to the community and to the public. And then finally, Every GSC client must be reevaluated once every 3 years to make sure that you're adhering to our GSC standards and that you are keeping pest populations at low levels or eliminating pests altogether. Next. So if you are interested in becoming GSC certified, please contact my colleague, Leah McSherry at lmcSherry@ipminstitute.org to schedule your on-site evaluation. You can also let Leah know the promo code GSC Intro to receive $125 off your first evaluation. Thank you for your time, and now I'm happy to answer any questions that you might have about GSC or indoor pest control.
So thank you, Ryan, and for sharing the resources of the Institute, especially the Green Shield certification. And some of you who've joined us today will remember Tom Green, who's the co-founder of the Institute, who did a walkthrough in your facility with his knee pad. So we always think of Tom Green, we think of Tom Green on the floor with his knee pads on, looking behind equipment to really assess a facility. And that great work has really helped to shape and form the Green Seal certification process. We have a question for you. How long does the process take for Green Shield certification, and what does it cost?
Yeah, thank you for having me. So the Green Shield certified costs around $1,250 per evaluation, and that's at the baseline. And it depends on how many buildings that are being evaluated, plus the travel for the evaluator. And for the facilities, though, we're only charging for that evaluation cost. And then the second question was how long the process takes. We do the evaluation, and about a month or so, we give you the interim report, and you have a year to address all the recommendations that are in the interim report to get your certification.
Great. There are a bunch of questions here that we won't have time to go through that you could just answer in the chat, but one of them is, do you certify pest control companies or just facilities?
Yes, most of our certified are actually pest control companies. So they do the same process every 3 years, but then there's also annual renewal. So they have to continue to share their products that they're using with us to make sure that they're GSC compliant.
Great. Thanks a lot, Ryan. And if you can just answer some of the other questions in the chat, that would be great. And Shirley, back to you. We're running a few minutes late. I hope everybody.
Thanks so much for watching our expert on IPM. I'm Sean Lynch, the director of the IPM and Healthcare Facilities Project at the Maryland Pesticide Education Network. We hope this has inspired you to consider new steps you can take to make your facility safer for your patients and staff. Please reach out to me at email at sean@mdpestnet.org if you have any questions regarding implementing IPM at your facility. To learn more, please visit the project at mdpestnet.org. Choose projects and then the IPM and Healthcare Facilities Project.